Okay, so have you ever, been on a hike and later find out you probably walked right through a tick nest?
Oh, yeah. I've totally been there.
It's a little unsettling when you think about all those tiny little Lyme disease carriers just waiting to hitch a ride.
Definitely makes you appreciate a good tick check.
Big time. And that's exactly what we're diving into today, Lyme disease. We're going way beyond the basics here.
It's more than just those awareness pamphlets.
Exactly. We want to equip you with the knowledge to not only recognize Lyme disease, but hopefully avoid it altogether.
Because, it can be a really sneaky illness.
Oh, absolutely. It's like a master of disguise.
It really is.
Yeah.
A lot of people don't realize how easily it can masquerade as something else, and that makes early diagnosis so tricky.
It's true. You might think you just have a summer cold, but it could be Lyme disease brewing.
And by the time you realize it, those little poppy seed-sized ticks have already done their damage.
Speaking of those ticks, can we talk about how tiny they are? I mean, the nymphs are almost impossible to see.
They are incredibly small, which is why prevention is so important. We need to be proactive, even in areas we might not think are high risk.
And it's not just a U.S. problem, right?
Nope, not at all. We're seeing cases of Lyme disease increase in Europe and Asia, too. It's a global issue.
So Lyme disease is global, it's sneaky, it's tricky. Let's break down the disease itself.
Okay, so Lyme disease, it's often called the great imitator.
Yeah.
And for good
And
reason.
it's like it's trying to trick you.
Right. Early symptoms, they often mimic a common cold or flu. Things like fever, chills, muscle aches, fatigue. You wouldn't think Lyme disease right away.
Especially since those symptoms can take a while to show up after a bite.
Yeah, anywhere from 3 to 30 days.
That's a huge range, so you might not even connect those symptoms back to a tick bite.
Exactly. And to make matters even more complicated, that classic bullseye rash, the one everyone associates with Lyme disease.
Well, it's like the calling card, right?
You'd think so, but it doesn't always show up.
Seriously.
Yeah.
So if you don't have the rash, how are you supposed to know if you have Lyme disease?
That's where things get a little bit tricky. Doctors have to rely on a few different factors to make a diagnosis. They look at your potential exposure to ticks, your symptoms, and of course, blood tests.
But I've heard that blood tests aren't always accurate, especially early on.
That's a really important point. Blood tests for Lyme disease, they work by detecting antibodies. Those are like your body's little defenders that target the Lyme bacteria.
Okay, so they're looking for your immune system's response to the infection.
Exactly. But here's the thing. It takes time for your body to produce those antibodies. So if you get tested too soon after a bite, the test might come back negative even if you are actually infected.
So it's a bit of a waiting game.
It can be, yeah. And that's why it's so important for doctors to consider the whole picture, not just the test results in isolation. They need to take into account your symptoms, your potential exposure, and all of that.
It sounds as diagnosing Lyme disease can be a bit of a puzzle.
It definitely can be. But the good news is that when Lyme disease is caught early, it's treatable.
That's reassuring. And what's the typical treatment?
Antibiotics are the go-to treatment for Lyme disease. There are different types that are commonly prescribed, and the specific choice depends on various factors, like the patient's age, if they're pregnant, things like that. Doxycycline is a common one for adults and older kids, while amoxicillin, or ciprofloxacin, might be used for younger children or pregnant women.
So different options for different folks. Makes sense. But I know there's also this thing called chronic Lyme disease, and I've heard it's a bit controversial.
It is. Chronic Lyme disease is a much more complex situation. Basically, it's when people continue to experience symptoms even after completing a standard course of antibiotics.
So the initial infection is gone, but the symptoms linger.
That's the idea. But there's a lot of debate within the medical community about the causes of chronic Lyme and how to best treat it.
I see. So there's not necessarily a clear consensus on the best approach.
Not yet. Some healthcare providers believe that longer courses of antibiotics are necessary to fully eradicate the bacteria, while others think that chronic Lyme is more of a post-treatment syndrome, where the initial infection has triggered some kind of ongoing immune response or inflammation.
So two different schools of thought on what's driving those persistent symptoms.
Exactly. And that, of course, leads to different treatment approaches.
This is definitely getting into some murky waters. But before we get too deep into the chronic Lyme debate, let's shift gears a bit and talk about how to avoid this whole mess in the first place.
Let's talk prevention.
Exactly. I mean, prevention is always the best medicine, right?
Absolutely. And when it comes to Lyme disease, there are a lot of practical steps you can take to minimize your risk.
Okay, so give us the lowdown. What are the essentials?
Well, it all starts with being aware of your surroundings.
Mm.
Knowing where ticks live and thrive is key. Are you in a wooded area? A grassy field? Near water? Ticks love those kinds of environments.
So understanding the tick habitat in your area is step one. What about actually avoiding those tick bites? What can we do?
Dress for the occasion. When you're in tick territory, wear long pants, long sleeves, tuck your pants into your socks, that kind of thing.
So we're going for the full tick-proof ensemble.
Exactly. And light-colored clothing can help too. It makes it easier to spot those little guys.
Oh, that's a good tip. And of course, we can't forget the insect repellent.
Repellent is essential. Look for products containing D, E, or permethrin.
E and permethrin. Got it. Anything else we should know about repellents?
Yeah, actually, you can also spray your clothes with permethrin. It actually bonds to the fabric and can last through several washes.
Oh, that's smart. Longer lasting protection. Okay, so we've covered clothing and repellents. What else is there?
Tick checks are crucial. After you've been outdoors,
Yeah.
always do a thorough check of your body, your pets, your clothing, everything. Ticks are masters of hide and seek, and they can be really tiny, so be meticulous.
Got it. No tick left behind. And what if we do find a tick latched on?
Don't panic. There's a specific way to remove them safely. Use fine-tipped tweezers to grab the tick as close to the skin as possible and then pull upward with steady, even pressure.
Okay, so no twisting or jerking.
Exactly. That can actually break off the tick's mouth parts and leave them embedded in your skin, which just increases the risk of infection.
It was like a mini surgery. And I guess if you're not comfortable removing a tick yourself, you can always see a doctor.
Definitely. Better to be safe than sorry.
So we've covered the basics of tick prevention, but what are the warning signs that someone might have Lyme disease? What should they look out for?
Keep an eye out for that bullseye rash, of course. But remember, it doesn't always appear. So pay attention to any flu-like symptoms that develop within a few weeks of a possible tick bite. Fever, chills, muscle aches, headaches, fatigue.
It's like a checklist of potential Lyme disease symptoms.
Pretty much. And if you're ever in doubt, it's always best to consult with a doctor.
Agreed. It's better to err on the side of caution when it comes to something like Lyme disease.
Absolutely. Early diagnosis and treatment are key to preventing those long-term complications that we talked about earlier.
Okay, so we've covered a lot of ground here. We've learned about how sneaky Lyme disease can be, how tricky it can be to diagnose, and the importance of prevention.
We've gone deep on the tick world.
But there's still so much more to explore. We need to delve deeper into those different stages of Lyme disease, unpack the blood testing process a little more, and really get into the nuances of chronic Lyme.
There's a lot to unpack, and that's exactly what we'll be doing in our next segment. We'll break down those stages, talk about the different types of blood tests, and dive into the ongoing debate surrounding chronic Lyme disease.
It's going to be a fascinating journey. So stay tuned, folks. We'll be right back after a short break. Okay, so we've talked about how Lyme disease is this like sneaky chameleon, right? It can really blend in and trick you.
It definitely can.
But to really get ahead of it, we need to understand how it works, how it progresses.
Right, like we need to know its MO.
Exactly. And you mentioned stages earlier.
Yeah, think of Lyme disease as having three main stages. Early localized, early disseminated, and then late disseminated.
Okay, those sound a bit intimidating.
They do, I know. But they actually describe a pretty logical progression of the infection.
Okay, less intimidating already. So let's start with stage one. Break it down for us.
All right, so early localized Lyme disease, this is usually the first stage you'll see. And it usually occurs within, I'd say, days or weeks after a tick bite. It's when the bacteria are still kind of hanging out just around the bite site.
Got it. So they're still localized, like contained.
Yeah, they haven't spread yet.
Is this when we might see that infamous bullseye rash?
You might. That's the erythema migrans rash, the fancy name for the bullseye.
Erythema migrans.
Yeah, so this starts as a small red spot, right at the bite site. And then it gradually expands outward, creating that classic ring shape.
Okay, I can picture it. But you mentioned that the rash doesn't always appear. So what happens if there's no rash? How do you know if you have Lyme disease?
Well, even without the rash, you might still experience some of those flu-like symptoms we talked about. Fever, chills, those aches and pains, maybe some fatigue.
So it can be really hard to tell.
It can. The key is to think about the timeline. If those symptoms pop up within a few weeks after a possible tick bite, then Lyme disease should definitely be on your radar.
Okay, so vigilance is key, especially after a tick bite. But let's say those early signs are missed, or maybe they're mild enough that they go unnoticed. what happens next?
Well, if Lyme disease isn't treated in that early localized stage, then the bacteria can start to spread. They get a bit more adventurous.
They're on the move.
Yeah, and that's when we move into early disseminated Lyme disease, which is stage 2.
Okay, so the bacteria are spreading throughout the body. Does that mean the symptoms get worse?
They can, yes. You might still have those initial flu-like symptoms, but you could also start to see some neurological involvement.
Neurological involvement. That sounds scary.
It can be. One common sign is something called facial palsy.
Facial palsy, what's that?
It's basically a temporary weakness or paralysis of the facial muscles.
Wow, okay. Things are getting serious. Are there any other symptoms people might experience at this stage?
Yeah, there can be. Some people develop heart problems like irregular heartbeat or palpitations, and some people even develop multiple erythema migrans rashes.
Wait, multiple rashes, like bullseyes all over?
It can happen,
Yeah.
and it's a pretty clear sign that the infection is spreading.
Okay, multiple bullseye rashes, definitely not something to ignore. But what's the worst case scenario here? What happens if Lyme disease still isn't caught and treated?
Well, that takes us to the final stage, late disseminated Lyme disease, and this can happen months, even years after that initial infection.
So the bacteria really had time to dig in.
They have, unfortunately. And at this point, they can start causing some serious damage to different organs and systems in the body.
I'm guessing this is where those long-term complications come in.
You got it. In late disseminated Lyme disease, you might see some pretty severe joint pain and swelling, particularly in the knees. Some people develop neurological problems like meningitis, which is inflammation of the membranes around the brain and spinal cord, or encephalitis, which is inflammation of the brain itself.
Wow, those sound incredibly serious. It really drives home the importance of catching Lyme disease early, doesn't it?
It does. Early diagnosis and treatment are so crucial for preventing these kinds of long-term complications.
But even with treatment, is it possible that some people still experience some lingering symptoms?
It is, and that brings us back to chronic Lyme disease. It's a complex issue, and there's still a lot of debate within the medical community about what's causing those persistent symptoms.
Right, we touched on that earlier, but can you remind us what the different viewpoints are?
Of course. So one perspective is that chronic Lyme is a persistent infection, meaning the bacteria haven't been completely eradicated even after a standard course of antibiotics.
Okay, so the bacteria are still lurking around, causing trouble.
That's the idea. The other viewpoint is that it's more of a post-treatment syndrome, where the initial infection is gone, but the body is still kind of dealing with the aftermath.
Like lingering damage or inflammation?
Exactly. And this difference in opinion, of course, leads to different approaches to treatment.
So it's not always a clear path forward.
It's not, unfortunately. And it can be really frustrating for patients who are struggling with these ongoing symptoms.
I imagine. So what's the advice for someone who's dealing with chronic Lyme and trying to find the right care?
I think the most important thing is to be your own advocate. Do your research, talk to different healthcare providers, and don't be afraid to ask questions and push for answers.
It's about being proactive and informed.
Exactly. And remember, you're not alone in this. There are support groups, online communities, and advocacy organizations that can offer information, resources, and a sense of community.
It's a reminder that even with these complex medical challenges, there's strength in connecting with others who understand what you're going through.
That's right. Shared experiences can be really powerful.
Okay, so we've talked about chronic Lyme, but let's circle back to those blood tests we discussed earlier. You mentioned that antibodies take time to develop. Can you explain that a bit more?
Sure. When your body encounters those Lyme disease bacteria, your immune system kicks into gear and starts producing antibodies.
Antibodies, those are the little defenders, right?
Yep. They're specifically designed to target those Lyme bacteria. But this process, it takes time.
So if you get tested too soon after a bite, those antibodies might not show up yet.
That's exactly right. And that's why a negative blood test early on doesn't necessarily mean you don't have Lyme disease. If a doctor suspects Lyme based on your symptoms and potential exposure, they might recommend repeating the test a few weeks later.
Got it. Timing is everything with these tests. And what about the different types of tests? I've heard there are a few.
You're right. There are two main types of blood tests used to diagnose Lyme disease. One is called an ELISA test.
ELISA, what does that stand for?
It stands for Enzyme-Linked Immunosorbent Assay. It's a mouthful, I know.
I'll just stick with ELISA.
Sounds good. So the ELISA test, it detects antibodies to the Lyme bacteria in your blood.
Okay, so it's looking for those little defenders. And what's the other test?
The second test is called a Western blot. This one is a bit more specific. and is often used to confirm the results of an ELISA test.
So it's like a double check to make sure the diagnosis is accurate.
Exactly. The Western blot actually looks for specific proteins from the Lyme bacteria, and that gives doctors a bit more detailed information about the infection.
Okay, so ELISA and Western blot, are these tests like foolproof or can they still be wrong sometimes?
Unfortunately, no test is perfect, and that includes Lyme disease testing. There's always the possibility of false negatives, especially early in the infection when those antibodies haven't had time to develop. And there can also be false positives, which means the test says you have Lyme disease when you actually don't.
Okay, so it's not always a clear-cut yes or no.
It's not. And that just adds another layer of complexity to the diagnostic process.
It does. So it sounds like communication with your doctor is really key here.
Absolutely. They'll consider all the factors. Your symptoms, your potential exposure, the test results, everything, to try to make the most informed diagnosis possible.
It's a team effort.
Yeah.
And speaking of complex, the treatment for chronic Lyme also seems to have some gray areas.
It does.
Yeah.
And we talked about the controversy earlier, but can you elaborate on the different viewpoints within the medical community? Like, what are the arguments?
Sure. So the debate really centers around the very definition of chronic Lyme disease. Some healthcare providers believe that it's a persistent infection that needs long-term antibiotic treatment to fully eradicate the bacteria.
Okay, so one camp believes the bacteria are still there, causing problems.
Yep. While others see chronic Lyme as more of a post-treatment syndrome.
Meaning the infection is gone, but the symptoms linger. Exactly. And they might think that those lingering symptoms are due to some kind of ongoing immune response or inflammation that was triggered by the initial infection.
So two very different perspectives on what's driving those persistent symptoms.
Right. And of course, those different perspectives lead to different treatment approaches.
Makes sense. So walk us through those different approaches. What do they look like?
Well, for those who believe in the persistent infection theory, they often advocate for longer courses of antibiotics, sometimes lasting for months or even years.
Wow, that's a long time to be on antibiotics.
It is, and it's not without its risks.
Right, antibiotics can have side effects.
They can, and that's why it's so important to weigh the potential benefits against the risks.
So what's the approach for those who view chronic Lyme as a post-treatment syndrome?
Their focus tends to be more on managing the individual symptoms and addressing any underlying conditions that might be contributing to them.
So a bit more of a holistic approach looking at the bigger picture.
Yeah, that's a good way to put it. It might involve things like pain management, physical therapy, cognitive rehabilitation, even lifestyle changes. It really depends on the individual and their specific symptoms.
So it sounds like there's no one-size-fits-all solution for chronic Lyme.
Unfortunately, no. And that lack of consensus can be really tough for patients who are just trying to find relief.
I bet. So what's the advice for someone who's trying to navigate this complex world of chronic Lyme and find the right treatment for them?
I'd say the best advice is to be informed and empowered. Do your research, talk to multiple healthcare providers, and don't be afraid to advocate for yourself. It's your health, and you deserve the best possible care.
Absolutely. You have to be your own champion, especially when dealing with a complex and controversial illness like chronic Lyme. But before we get too lost in the chronic Lyme maze, let's shift gears for a moment and talk about how to avoid this whole Lyme disease situation altogether.
Let's talk prevention.
Exactly. Because ultimately, the best way to deal with Lyme disease is to avoid getting it in the first place. And luckily, there are lots of things we can do to reduce our risk. So let's dive into the world of Lyme disease prevention in our next segment. We'll talk about tech habitats, protective clothing, repellents, tick checks, all the essentials for staying safe and tick-free. Okay, so we've covered a lot, right? All the ins and outs of Lyme disease.
The sneaky symptoms, the testing, the whole chronic Lyme controversy.
It's a lot to process. But now let's talk about how to skip all of that drama.
Yeah, let's talk about how to avoid this whole Lyme disease thing altogether.
Prevention is key.
Prevention is the best weapon we have, absolutely. And luckily, it's not that complicated.
Okay, good. So give us the rundown. What are the essentials?
Well, you've got to start with awareness, like we were saying before. You need to know where those ticks are hiding.
Right, knowing your enemy and all that.
Exactly. Is it wooded? Grassy? Near the water? Knowing the tick habitat in your area will help you tailor your prevention plan.
Makes total sense. Okay, so we know where the ticks are. Now, how do we actually avoid those bites? What can we do?
Dress smart. When you're heading into tick territory, think long pants, long sleeves, and tuck those pant legs into your socks.
Like a full tick-proof suit of armor.
Pretty much. And stick to light-colored clothing, too. Makes those little ticks easier to spot.
Good tip. And, of course, we can't forget the insect repellent.
Absolutely essential. DET or permethrin are your best bets.
Right, we talked about those earlier. Anything else about repellents we should keep in mind?
Oh, one more thing. You can spray your clothes with permethrin. It actually binds to the fabric.
Oh, so it lasts longer.
Yep, it can even last through a few washes.
Smart. Okay, clothing and repellents, check. What else?
Tick checks, tick checks, tick checks. Can't emphasize this enough. After being outdoors, do a thorough check. Head to toe, your pets, clothing, every nook and cranny.
Leave no tick unturned.
Exactly. They're tiny and love those warm, moist spots. So pay special attention to, like, your scalp, armpits, behind your knees.
Good to know. And if we do find a tick latched on, remind us, what's the proper removal technique?
All right, first, don't panic. Grab those fine-tipped tweezers.
Yeah.
Get as close to the skin as you can and pull upward with steady, even pressure.
So no twisting or yanking?
Nope. That can actually break off the tick's mouth parts, leaving them stuck in your skin. Not good.
Makes sense. Like a tiny little surgery. Okay, but even with all these precautions, let's say someone still gets a tick bite. What are the red flags? When should they call the doctor?
Well, the bullseye rash is always a big one. But like we said, it doesn't always show up.
Right, that's the tricky part.
It is. So really pay attention to any flu-like symptoms that pop up within a few weeks of a possible tick bite.
Yeah.
You know, things like fever, chills, muscle aches, fatigue.
So if you have any of those symptoms after a tick bite, it's better to err on the side of caution?
Definitely. It's always best to check in with your doctor if you're unsure.
Agreed. Early diagnosis is so important.
It can really make all the difference.
You know, it's amazing how much we've learned about these tiny creatures and their impact on our health.
It's been a real deep dive.
It has, and I think the biggest takeaway for me is the importance of knowledge.
I agree with that.
The more we understand about Lyme disease, the better we can protect ourselves.
And our loved ones, too.
It's not just about knowing the facts either. It's about sharing that knowledge with our communities, spreading awareness.
Exactly. Lyme disease is a public health issue. We need to work together to fight it.
Well said. So, to our listeners out there, stay curious, stay informed, and stay healthy.
Lyme disease is serious, but with the right knowledge, we can manage it and even prevent it.
Absolutely. And remember, there's tons of information available online from reputable sources like the CDC, the Lyme Disease Association, and of course, your healthcare provider.
Don't be afraid to ask questions. Your health is worth it.
And if you found this deep dive helpful, share it with your friends and family. Spreading awareness is one of the best ways to fight Lyme disease.
Absolutely. We all need to do our part.
That wraps up our deep dive into the world of Lyme disease. We hope you learned something new and feel empowered to take charge of your